In my home state and across the country, we continue to see the devastating impact that the substance use disorder crisis is having on our families, our communities, and our economy. It's one of the most pressing public health, safety, and challenges that we have in New Hampshire. And it's one that has just an extraordinary ripple effect. And we know that the COVID-19 pandemic exacerbated the crisis. Those struggling had less access to in person treatment and recovery services, as well as less access to mental health support. At the same time, added social isolation, stress, and anxiety from the pandemic increased the chance that an individual could become addicted or experience a relapse. So, to address this crisis, we need to do more to get people the support that they need. And that includes improving access to truly effective treatment. As many on this call have already discussed, and I know that my friend Representative Paul Tonko has been with you or is going to be with you, and I admire and appreciate his work in this space as well. Medication assisted treatment is one of the best options that we have for treating patients who are grappling with substance use disorder. Yet there are a lot of restrictions still that prevent healthcare providers from prescribing certain forms of medication assisted treatment. And while we're certainly pleased that the Biden administration announced that they're removing some of the burdensome training requirements, there's still more Congress can do to better ensure access to treatment for those who need it. That's why we have to pass the bipartisan Mainstream Addiction Treatment Act, which I introduced, as you all know, with Senator Lisa Murkowski. This is a bipartisan bill and has bipartisan support. And the fact that it does is a testament to all of your efforts to educate lawmakers about the importance of medication assisted treatment. It is truly the gold standard for treating substance use disorder. And our bill would expand access to medication assisted treatment for those struggling with opioid use disorder by eliminating this outdated waiver requirement, which prevents so many providers from being able to prescribe medication assisted treatment to their patients. By eliminating this bureaucratic hurdle, we can get more Americans the treatment that they need and help in the effort to save lives. My colleagues and I are working to get the bill passed at every opportunity that we have. We are getting closer. I will tell you that when I say to people, a doctor doesn't need special training or a special waiver to prescribe an opioid, but they need a special waiver in order to treat somebody who became addicted to opioids, that tends to resonate with people. And I think we're making real progress in that regard. But we've got to keep at it. So I'm hopeful that if we stay the course, we'll see the MAT Act become law so more people who are in need can access this life-saving recovery medication. I have been working on this really since the early days of my first term as governor, when all of a sudden we saw the numbers of overdose deaths just skyrocketing in our very small state. Partly, of course, because of some of the gaps in our overall behavioral health safety net, but partly too because we became a target for the cartels that were flooding the market with fentanyl. And obviously, the opioids that people were using either were substituted or laced with fentanyl. The thing that has made a real difference as we have been tackling this challenge is the advocacy of groups like all of yours. And the fact that you all have been willing not only to speak about the causes of substance use disorder, but also the solutions, the fact that you have been able to help people see this as the behavioral health challenge that it is, like any illness, and the fact that you have helped people speak up about their experiences, both from the patient side as well as the provider side. At the end of the day, this is about supporting people and really helping them see themselves as worthy of support and help and treatment, and destigmatizing substance misuse. And that's, at the end of the day, what this is all about: getting people treatment for an illness that they have so that they can re-engage with their communities and build the kind of life for themselves and their families that we all want to build, right? Thank you so much for what you've all already done. Thank you for what you will do. I want to make sure that we pass the MAT Act, but then we really take action to fund treatment, to support mental health services, and to hold Big Pharma accountable for their role in this crisis. I am grateful to everyone here today. I know this is a really broad coalition, and it's a really important one because that's how we're going to tackle this and end this epidemic once and for all. I look forward to your continued work. I thank you for your steadfast support of the MAT Act. And let's get the bill across the finish line and then turn to the next task ahead. Thanks, everybody. Be safe.